Do your hips feel stiff the moment you open your eyes in the morning? Maybe you wake up feeling like your body just won't cooperate. You try to shift your legs to the edge of the bed, and there's that familiar tightness, that dull ache in your hips that makes you hesitate before you even try to stand up. If that sounds like your morning, you are not alone. Hundreds of older adults experience this exact feeling every single day. And many of them have started to quietly wonder, is this just something I have to live with now? The answer is no. Not necessarily. Today, I'm going to show you a gentle, 2-minute bed exercise routine specifically designed to help loosen stiff hips, and the beautiful part is, you don't have to stand up to do it. You can do every single movement right here, lying in your bed, exactly where you are right now. These movements are slow. They are safe. And when done consistently, they may help you start your mornings feeling a little more comfortable, a little more confident, and a little more ready to move through your day. Now, before we get started, a quick and important note. This routine is for general wellness and gentle mobility support. It is not a treatment or cure for any medical condition. If you experience any sharp or severe pain during these movements, please stop immediately and speak with your doctor or physical therapist before continuing. Your safety always comes first. Alright, let's get into it. But first, if you are watching this video right now, there is a very good chance that you or someone you love is looking for simple, practical ways to stay active and mobile as the years go by. That is exactly what this channel is all about. Every single week, we share gentle exercises, everyday health tips, and practical habits designed especially for older adults who want to stay strong, independent, and active, without complicated equipment or intense workouts. If that sounds like something that would help you or someone in your life, please take just 2 seconds right now to hit that subscribe button below this video, and tap the bell icon so you never miss a new upload. It costs nothing. And it means that every week, helpful, trustworthy health content comes directly to you. Alright, now let's talk about what is actually happening inside your hips, and why mornings can feel so difficult. Your hip joint is one of the most important joints in your entire body. It is a ball and socket joint, meaning the rounded top of your thigh bone sits inside a cup-shaped socket in your pelvis. This design allows your hips to move in many directions, forward, backward, sideways, and in rotation. When your hips are working well, you barely notice them. But when they start to stiffen up, you feel it in almost everything, getting out of bed, rising from a chair, walking upstairs, or even just turning over at night. So why does this happen? Why do hips become stiffer as we get older? There are several reasons, and understanding them can actually help you feel less frustrated about what your body is going through. First, reduce daily movement. As we age, many of us naturally become less active. Maybe it's due to retirement, health concerns, discomfort, or simply spending more time at home. But here's the problem: your joints need movement to stay healthy. When you move less, the muscles and soft tissues around your hips can begin to shorten and tighten over time. And that tightness is what you feel as stiffness. Second, muscle weakness. The muscles that support your hips, including your glutes, hip flexors, and inner thigh muscles, tend to weaken with age, especially if they aren't being regularly used. When the muscles around a joint weaken, the joint itself becomes less stable and more prone to tightness and discomfort. Third, joint wear over time. After decades of walking, standing, and moving, the cartilage inside the hip joint can gradually thin out. Cartilage is the smooth tissue that cushions the joint and allows the bones to glide past each other easily. When that cushioning decreases, movement can feel less smooth, and sometimes more uncomfortable. Fourth, reduce joint lubrication. Your hip joint is surrounded by a fluid called synovial fluid. Think of it like the oil in a car engine. It keeps things moving smoothly. But when you haven't moved in a while, such as after a full night of sleep, that fluid isn't being circulated through the joint. This is a big reason why so many people feel their stiffest first thing in the morning. Fifth, long periods of lying down or sitting. When your body stays in the same position for hours, whether sleeping through the night or sitting in a chair for most of the day, the muscles and connective tissues around your hips begin to adapt to that fixed position. When you try to move again, they resist. That resistance is the stiffness you feel. Here is the encouraging part. Gentle, consistent movement is one of the most effective things you can do to address all 5 of these factors. Not intense exercise. Not pushing through pain. Just slow, deliberate movement, done regularly, can help keep your joints lubricated, your muscles engaged, and your mornings more manageable. That is exactly what this routine is designed to do. Now, you might be wondering, why do these exercises in bed? Why not just stand up and stretch? That is a completely fair question, and here is the honest answer. For many older adults, especially those over 70, 80, or 90, getting up from bed can itself be the hardest and most risky part of the morning. Falls most commonly happen during transitions, when you're moving from lying down to sitting, or from sitting to standing. Bed exercises allow you to warm up your joints and gently activate your muscles before you attempt to stand. That preparation can make the transition safer, smoother, and less painful. Let's look at what gentle bed exercises can specifically do for your hips. They warm up the joint safely. Slow, gentle movements encourage synovial fluid to circulate through the hip joint, reducing that stiff, grinding sensation you might feel first thing in the morning. They improve circulation. Lying still overnight slows blood flow through your legs and hips. Gentle movement gets the blood moving again, which can help reduce achiness and that heavy feeling in your lower body. They reduce morning stiffness. This is the most direct benefit. When you move your hips through a gentle range of motion before standing, you give the surrounding tissues a chance to loosen up gradually, rather than forcing them into action all at once. They build confidence before standing. There is a psychological benefit too. When you've already moved your hips and they feel a little looser, you approach that moment of standing with more confidence and less fear. They prepare your hips for walking. Think of this routine like warming up a car engine on a cold morning. You wouldn't rev a cold engine immediately. You let it warm up first. These exercises do the same thing for your hips, so that by the time you take your first steps, your body is actually ready. And perhaps most importantly, consistency matters far more than how intensely you do these movements. 5 minutes of gentle daily movement will do far more for your hip health over the long term than one intense session every few weeks. Small and steady is the approach that actually works. All right, let's do this together. Find a comfortable position lying flat on your back in bed. Your pillow can stay under your head. Make sure you have enough room to move your legs gently without hitting the side of the bed. Take one slow breath in through your nose and breathe out through your mouth. We are going to do 4 simple movements. Each one targets your hips from a slightly different angle. Together, they take about 2 minutes. Let's begin. Exercise 1, heel slides. Start with both legs extended flat on the bed. Very slowly, bend one knee and slide that heel up toward your body, dragging it gently along the mattress. Slide it as far as feels comfortable. There should be no sharp pain. Just a gentle stretch through the hip and thigh. Then slowly slide that heel back down until your leg is flat again. That's one movement. Slow and controlled. Keep breathing normally. There's no rush here. Let your hip open up at its own pace. Continue sliding that heel up and back down for 30 seconds. Then we'll switch to the other leg. Switching sides now. Now the other heel. Same movement, slow slide up, slow slide back down. Feel that hip gently waking up. If one side feels stiffer than the other, that is completely normal. Just work within your comfortable range. Never push into pain. 30 seconds. Good. Exercise 2, gentle knee open and close, hip rotation. Now, bend both knees so that your feet are flat on the mattress, hip width apart. From here, very gently let both knees fall open to the sides, like a book slowly opening. Go only as far as is comfortable. You should feel a gentle stretch through your inner hips. Then slowly bring your knees back together. Open and close. Open and close. This movement targets the inner hip muscles and hip rotators, areas that often carry a lot of tension, especially after lying still all night. Keep the movement slow and fluid. There is no bouncing, no forcing. Just a gentle, rhythmic opening and closing. Continue for 30 seconds. Excellent work. Exercise 3, single knee to chest stretch. Keep both feet flat on the mattress. Now, using both hands, gently grasp one knee and slowly draw it toward your chest. Only go as far as feels comfortable. You should feel a gentle stretch deep in the hip and lower back. Hold that position. Breathe. Don't pull aggressively, just let gravity and the weight of your arms do the work. This stretch targets the muscles at the back of the hip, your glutes and deep hip rotators. These are muscles that tighten considerably when you sleep, and releasing them gently can make a significant difference in how your hips feel when you finally stand up. Hold for a count of 10, breathe in, breathe out. Now slowly release that leg and place your foot back on the mattress. Take a breath. Then draw the other knee toward your chest. Hold, breathe, feel the stretch. Count of 10, and slowly release. Both legs back flat. Well done. Exercise 4, slow pelvic tilts. Still lying on your back with both knees bent and feet flat on the mattress. This final movement is very subtle, but incredibly effective for loosening the lower hip and back region. Gently tighten your abdominal muscles. Think of pressing your lower back softly into the mattress. Hold for 2 counts. Then release. That gentle pressing and releasing is a pelvic tilt. You are not lifting your hips off the bed. This is not a bridge exercise. It's a micro movement, a slight flattening of the lower back against the mattress, then a release. It activates the deep core and hip muscles, gently mobilizes the lower spine, and helps prepare your body for the act of sitting up. Continue at your own pace for 30 seconds. Press and release. Press and release. And that is your 2-minute hip routine. For exercises. Done entirely in bed. Done entirely in your own comfort zone. Take a slow breath in. And breathe out. You just gave your hips a wonderful gift this morning. If you just followed along with that routine, I want to hear from you. Go ahead and type the word "done" in the comments section below this video right now. Just that one word. Because here's what happens when you do. Someone else who is watching this video, maybe someone who is hesitant or unsure whether to try these exercises, will scroll down and see your comment. And that one word from you might be exactly the encouragement they need to get started. Your consistency inspires other people. So drop that comment. Let me know you showed up for yourself today. Now that you've experienced the routine, I want to take a few minutes to talk about the mistakes I see most often, because how you do these exercises matters just as much as doing them at all. 1. Moving too quickly. This is probably the most common mistake. When people first try these exercises, there's a temptation to rush through them, especially if you're trying to get out of bed and start your day. But speed is the enemy of this routine. The slower you move, the more deeply your muscles and joints can respond. Rushing tightens the very muscles you're trying to release. Slow is not lazy, slow is effective. 2. Holding your breath. You might not even realize you're doing it, but many people hold their breath when they're concentrating on movement. This actually increases muscle tension throughout your body. Breathing steadily, in through the nose, out through the mouth, keeps your nervous system calm and allows your muscles to relax into the stretch. If you catch yourself holding your breath, simply exhale slowly and continue. 3. Forcing a painful range of motion. There is a difference between mild stretch discomfort and actual pain. Stretch discomfort feels like a gentle pulling, it's manageable and fades as you move. Pain is sharp, intense, or worsening. If you feel real pain during any of these exercises, stop that movement immediately. These exercises should feel like relief, not punishment. Working within your comfortable range, even if it's small, is always the right approach. 5. Skipping daily practice. One session will not change your hip mobility. Neither will 3 sessions. Meaningful change comes from consistency, doing this routine every morning, or as close to that as possible. The good news is that it only takes about 2 minutes. That is genuinely one of the lowest time commitments in health and wellness. 2 minutes every morning is something almost anyone can find. 5. Trying to do too much on the first day. Some people feel great after their first session and immediately try to do 5 or 6 rounds of the routine, or add on a bunch of extra stretches they found somewhere else. This is well-intentioned but often backfires. When you introduce too much movement too quickly to muscles and joints that haven't been regularly challenged, you can end up feeling sore or discouraged. Start with 1 round, done gently. As your body adapts over days and weeks, you can naturally build from there. Progress in mobility is not dramatic. It is not sudden. But over 2 weeks of consistent gentle movement, many people notice real changes, less morning stiffness, an easier time getting out of bed, more confidence when they take their first steps of the day. That is worth 2 minutes every morning. While this routine is designed to be gentle and appropriate for most older adults, there are specific situations where you should speak with your doctor or physical therapist before trying any new movement routine. Please consult your healthcare provider first if you have had recent hip surgery. Whether it's a total hip replacement or any other hip procedure, your medical team will have specific guidelines about what movements are safe during recovery. Do not attempt any hip exercises without their clearance. If you have experienced a recent hip or pelvic fracture, your bones need time and professional guidance to heal properly. These exercises are not appropriate during active fracture recovery. If you are experiencing a severe arthritis flare-up, meaning your hip pain is significantly worse than usual and accompanied by swelling or heat in the joint, that is a signal to rest and speak with your doctor, not to push through movement. If you have sudden, new, or unexplained severe hip pain that is different from your usual discomfort, please have that evaluated before beginning any exercise routine. New pain can sometimes indicate a condition that needs medical attention. And if you experience numbness, tingling, or unexpected weakness in your leg or foot, those symptoms should always be discussed with a healthcare professional before you add any new movement to your routine. Now, please hear this clearly. Mild, manageable stretch discomfort during these exercises is normal, especially in the first few days. That gentle pulling sensation as you ease into a movement is your muscles and connective tissue responding to being stretched. That is expected and safe. What is not expected or safe is sharp pain, shooting pain, pain that worsens as you continue, or pain that persists for a long time after you finish. Those are signals to stop and seek guidance. When in doubt, check with your doctor. There is no exercise routine in the world worth doing at the expense of your safety. Let's bring it all together. Hip stiffness as we age is incredibly common, and it is not simply something you have to accept without trying to address it. Reduced movement, weakening muscles, decreased joint lubrication, and long hours of lying still all contribute to that familiar morning tightness. But gentle, consistent movement is one of the most powerful tools available to you. Today's 2-minute routine: heel slides, knee open and close, the single knee to chest stretch, and slow pelvic tilts, takes almost no time, requires no equipment, and can be done right where you wake up every morning. You do not need to be fast. You do not need to push hard. You simply need to show up for yourself, gently, every single day. Let me ask you something before you go. What age are you watching from today? Drop it in the comments. I genuinely love hearing from this community, and it helps me understand who I'm making these videos for. And if this video helped you, even a little, please take a moment to like it and share it with a friend or family member who starts their mornings with stiff hips. You might be giving them exactly the information they've been looking for. If you haven't subscribed yet, please do it now. Every week, we share simple, practical, evidence-informed health content designed for older adults who want to stay mobile, independent, and active for as long as possible. That is this channel's only purpose. Thank you for spending part of your morning with me. I'll see you in the next video. Take good care of yourself.